do not get the disease. And the best way to avoid it is hand washing, masking, and social distancing, as well as there's now a vaccine available. And this vaccine appears to be very safe, but with the caveat that it was not studied in pregnant women. And so we want to be very careful. But all the studies are ongoing, it appears to be safe, everything that's ongoing. And of course, we're learning every day that more and more about this disease. It does appear that the antibodies that are created during the vaccine, which actually are higher than if you get the disease itself, actually appear to cross the placenta and get into the baby's system. And early studies also suggest that those antibodies get into the breast milk and also may help protect the baby. Immunizations are amazing. They help protect so many adults out there, but they really help to protect our children and our little babies. If you're trying to get pregnant, making it a great time to get the vaccine, because if you're not already pregnant and it appears to be safe during pregnancy, then why not get it? Like anything, it has side effects, but it's a lot less of a problem than the actual disease, which is what happens for a lot of the vaccines.
How does stress impact fertility?
Stress in and of itself can have an adverse effect upon the way the hypothalamus, pituitary, and ovarian axis works. So in other words, it can sometimes affect, ovulation. A good example is, one level of stress that people consider is the stress of running. There's some women who will go out and run every day, like, preparing for a marathon, and they will completely shut their period off from the stress of the running and shutting the pituitary gland down. And they won't ovulate, they won't be able to get pregnant or anything. Other women, while they're running, they continue to ovulate, they continue to be able to get pregnant. And so stress can have an impact upon the way that the ovary works, but it is variable depending on the person and upon that person's ability to work, to work through those issues and stuff. And it's hard because everybody is different. One level of stress for one person does nothing. The same level of stress in another woman completely shuts her ovulation off.